Welcome to Living Hope, a weekly show designed to provide hope, inspiration, and education on pancreatic cancer. Sharing the real-life stories of those affected by this disease and how they deal with it on a daily basis. And today, well, to kick off, this is a brand new series for us here. Today, we have a very special guest with us. Let's bring her in and welcome her to our station here. We're talking about the founder of the Pancreatic Cancer Action Network, Pamela Acosta Marquardt. Marquardt. I was so close. Marquardt. I had it there. Welcome to OC Talk Radio and to Living Hope.
Thank you.
So, we got a lot to pack into for 20 minutes here. For those who don't know, you lost your mother to pancreatic cancer following a 6-month battle, right?
Correct.
And after discovering there was no organization that dealt with it, surprisingly, this is not that long ago. This isn't like 100 years ago. This is in 1996, I believe.
25 years ago this year.
So your mother contracts this and dies, and you said, so I got to do something about this. And so you became determined to ensure that patients and families had some place to go for information, resources, and what we're going to focus a lot on in the coming weeks, hope. And so you started off doing it. How did that affect you after your mother's death, and how did it launch this organization?
Well, it was actually during the time of my mom's journey, during that 6 months that she survived, that, when I went online to this brand new kind of World Wide Web, commonly known as the internet today.
Right. Hard to believe there was a time when it wasn't there. But
I know. And I was brand new to technology, too, so it was kind of comical, me trying to figure out how to navigate. But, of course, I searched for the organization that dealt with pancreatic cancer and found nothing. The only thing that I did find was a chat board that was provided by Johns Hopkins in Baltimore. There was a pathologist there who thought it was important to have a place where people could come together. And at that time, there was only, maybe a handful of people participating. As my mother's journey came closer to an end, I kept seeing more and more people gravitate to that chat board, coming in with their own stories and, looking for information to try to save their loved ones.
So or how to handle it or what to do. And just tell me what's going on. What's my chances? Well, how can I handle this? What's it going to be like?
Yeah, exactly. And most of the time, what they were getting from the doctors after diagnosis was, go home and get your affairs in order. I am so sorry, but you have pancreatic cancer and you probably have 3 to 6 months to live.
Wow.
And, my mother, being the compliant patient that she was, died 6 months later.
Yeah.
And so it was really during that time
I'm only laughing because that's what my mother and dad were. If the doctor said, go do this, go stand on your head in the corner for 3 hours, they would do that. Yeah.
Absolutely. I mean, you take the doctor's word as the gospel because that's how we were all raised.
Right.
So, when my mom first got diagnosed, I remember standing in the hospital room when that diagnosis came down, and my first thought was, oh my gosh, that's what Michael Landon died of. And I recall that he didn't survive very long after he went public with his announcement.
Yeah,
so
it was quick.
Yeah, so
and we're going to dive into this because we got a lot to pack in here about pancreatic cancer, how it relates to other cancers. They're not all the same. We'll dive into that in a second here, and why pancreatic cancer doesn't pop to the top of everybody's understanding and list, because it's certainly one of the deadliest. In fact, I guess we might as well say this here. I pulled up some facts just because I couldn't believe it, and I thought we got to tell this at least as part of the story. Pancreatic cancer, from what I've seen, is the 3rd leading cause of cancer-related deaths in the world, and I guess I'd argue it's one of the toughest, if not the toughest, cancer to survive, with just a 5-year survival rate of 10%. Only 10% of the people live 5 years with this thing. So it's approximately 48,000 people die a day. And if you were diagnosed with this, the general consensus is put your affairs in order. Your life is not long on this planet here.
And it's actually about 48,000 people in the United States per year.
Okay.
Out of, just approaching 58,000 that are being diagnosed. So while we have...
So it's a very deadly form of cancer
that
doesn't get much prominence in discussion, despite the fact lots of prominent people have died of pancreatic cancer.
Exactly. And I think at that point, beyond Michael Landon, most of the notable folks that lost their lives to pancreatic cancer, it never came out in the public. People just didn't know. I mean,
They just had cancer.
it was cancer, and people tend to throw all cancers into one bucket, and
Yeah.
that simply is not the case.
And so if I hear that cancer survivor among breast cancer is gone up, it's more women are, it's not as much of a death sentence as it was years ago. It's still very deadly and still very serious, but the survivor rate's gone up. Then I just assume that must be the case for all cancers: brain cancer, lung cancer, pancreatic cancer. Is part of the problem, I don't even know what the pancreas does
Well,
is.
who
I know where my
knows?
heart is. I know where my
Who knows
lung
that
is.
you even have a pancreas,
I
right?
didn't really know. No.
And so, but part of the problem, well, the real problem really is that number one, people don't even know you have a pancreas.
Right.
I certainly didn't know that.
Right.
And then because of the fact that we currently still to this day do not have an accurate early detection method,
Oof.
we don't have any what we call truly effective treatments.
Mm-hmm.
Those are the things, when you start having early symptoms of pancreatic cancer, they are seemingly so benign. I mean, it could be
Like what? What would you have?
indigestion. You could have, pain in the middle of your back. Maybe you pulled a muscle.
As you're
Just-
saying this, I'm feeling all of these.
Oh,
now.
of course. I know.
Wait a minute,
Sometimes
I
you
got
know
that.
too much,
Yeah.
right? But so many times patients are dismissed because typically the medical field looks for pancreatic cancer last instead of ruling it out first. So,
There must be some simple answer for these simple symptoms. Let's go through those, and if we don't, maybe you got something worse there at the end. Right?
Yeah, you would think, but that typically doesn't happen. So, part of what we do is really work on educating the medical profession, getting more awareness, and educating the general public to be their own best advocates and to speak up and to know that if they have certain symptoms, and most likely it's not going to be pancreatic
Sure.
cancer, but to push a little bit until they get the answers that they're looking for.
Well, let's dive into this a little bit. I'm not trying to set up a fight between different cancers here, but seems like some have done a better job of raising awareness, and I think specifically of breast cancer. My wife is very aware of breast cancer, as am I. Most males are now, and
Right.
so we're cognizant. If you get a lump, boy, you pay attention to it, and you every time she takes a shower or whatever, she goes through a routine to check through all this stuff, particularly because we're of a certain age, we're in our 60s here, and so men with whatever, testicular cancer, other sorts of things. You're sort of trained to sort of, is that a lump? Am I testing? Or skin cancer, melanomas
Right.
and stuff. What is this? I'm looking. Certain things we're trained to look for now here, and we're cognizant of them, and we're aware of them. I can't check my pancreas. I can't see if I got a lump on my pancreas or a spot on my pancreas. Is that part of the problem?
Well, it is part of the problem because, overall, the number of people that get diagnosed with pancreatic cancer every year is a fairly small amount. I mean, we think it's a lot. We think, 100 people is too many.
Right. And what did you say? It's like 50 or 60,000 a year or something?
Yeah, I mean, it's nearing almost 60,000. I mean,
So it's not
numbers are
60
climbing.
million. I mean, it's I don't.
No, the numbers are climbing, and that's in the United States here. The numbers are climbing every year, and part of that is just because we have an aging population.
Right.
Part of it is because we have created a lot more awareness where people are being diagnosed, where before it was just passed off and then they would die and they didn't ever check
So
to see
we'll
what
talk
it was.
about what
So-
it is and how you get it and how it relates to other things. But I just want to stick on this for a second here. So there are
Sure.
other types of roughly how many people get lung cancer or breast cancer or other sort? Do we have any idea?
Oh gosh, I want to say breast cancer is probably, I don't know.
A lot larger.
A lot larger. I don't know the actual numbers of breast cancer, like the most recent numbers.
So part of it, it's not affecting as many people as some of these other diseases are, so it's nothing. Part of it, I gotta believe, is it's just not something that's visible. It's not a spot on my face like
Right.
melanoma. It's not a lump on my breast. It's not something I can feel or see or quickly identify. It's just, it could be something you've got. You rattle off a couple of them there. I forgot what they were already here. Indigestion or some other sorts of
Right. It could be back pain. It could be
things.
sudden
I'm not going to
weight
think
loss.
cancer or that. Yeah, right.
Of course.
So it's not instantly visible, and it has to do with a part of the body I don't even know I have. So let's get it out there. What is the pancreas and where is it? I don't even know.
Well, so the pancreas, and this
And
is
what does
another.
it do?
Okay,
Right.
the pancreas is situated between your stomach and your spine,
Okay.
which is why sometimes you present with back pain.
Ah, okay.
The pancreas basically has two functions. It produces your digestive enzymes and it produces your insulin.
Oh, okay. Well,
So
that's a big one. Yeah.
so
right.
it's definitely an important part of your anatomy.
Right.
But again, it's for all the reasons that you've said,
I can't see it. I
You-
can't touch it.
you can't feel, you can't do anything. And that's why so many people, by the time they present with symptoms, many times a first symptom is jaundice. And that's simply because
Which is what you're changing. The skin is looking yellowy. or
yellowy,
something.
your
Yeah,
eyes can look yellow. And what happens is if there is a tumor in the head of the pancreas and it pushes up against the bile duct, you're going to present with jaundice. Well, usually by the time somebody presents that way,
Too late. We've got a problem.
there's a problem.
So, what is the normal way that they detect it? How do they, other than they start to see some of these symptoms emerge that seem benign and harmless at first until they rule it all out and think, uh-oh, we got a bigger problem here. How do they go in and do a biopsy? Do they do a scan? Do they look inside your body? Is there a blood test I can take that brings this out? How do I discover?
Not yet.
Not yet. Okay.
We're working on early detection methods, but typically if somebody has any of these types of symptoms, if they have a history of pancreatic cancer in their family, because we know now if you even have just one first-degree relative with pancreatic cancer, that the NCCN, which is the National Comprehensive Cancer Network, is now recommending that you get genetic testing just so that you can be armed with information. Knowledge is power.
And if I do catch it early, is there an intervention program? With breast cancer, they can go in and remove it. With other sorts, they can radiate it or treat it or something.
Absolutely.
So if I catch it early enough, do my odds go up? Or my risks go down?
Your odds definitely go up, but really, we're talking hope too. We have
Right.
more than a handful of people that were diagnosed at stage 4, meaning that the cancer has metastasized or spread beyond the pancreas.
Go.
And some of these people are now celebrating 8 years out, 9 years out. We never heard those stories
We have
before.
one of them sitting here, the woman who's our executive producer here, Roberta Luna. She's a 19-year survivor, and she's going to nod over here. She's sitting off camera. When you guys came in on one of our shows, I was fascinated, and I said, I've got to learn more about this, and there's got to be more information out there about this. But what we're really looking for in this show are stories, hope, and if not ultimate hope that you're going to live, and you can and you might, how do I deal with it during whatever days I have left? What does this journey look like for most people? They always say, like anything, first it's denial, and then it's anger, and then at some point you come to acceptance and how you're going to handle this in your life. Was it that way with your mother, or how did she? Some people deny it till the day they die. Some
Yeah.
people give up the minute they hear about it.
I don't think my mom was in denial until the day she died. I remember her saying to me, honey, can you ask the doctor why I'm so tired all the time? And this was just a few days before she passed. So, yeah, and I think I probably sheltered her from some of that information
It's
too.
your
And,
mom.
everybody's journey is a little bit different, but the fact that today there is more hope than there ever was before. We talk about why this disease has been so overlooked, so underfunded, and it's because, you think about breast cancer, that movement started in the early 80s.
And it became a movement, truly. I mean,
A
it was
movement.
I remember in the beginning, it was one of those, I don't want to hear about it. I don't want to talk about it. I don't want to think about it. We all live like the three monkeys, deaf, dumb, and blind. We
That's
cover our
right.
eyes, cover our ears, cover our mouth here. That image persists for me, That's certainly the way I am and all aging baby boomers. I hate to admit it, I'm one of those, I rarely go to the doctor because I don't want to know. Sometimes if I don't know, it's nothing wrong. I can't be sick. But if I go, then I discover it. And it's like, I know this is ridiculous, but, we live in that kind of denial of wanting to know. I don't know certainly that I'd want to know I had pancreatic cancer, but I wouldn't want to not know either, because if there
Well,
was a limited amount of time left, I'd want to make the most of it. And do it.
and that's part of what we talk to people about is, knowledge is power, and you
Yeah,
really
right.
do want to know. And I mean, who better to be an advocate for your own health but yourself, right?
Right.
So we want to empower people with knowledge that they can use to have a hopeful journey,
Right.
because the
And
thing
and again, I don't want to oversell this, and it's not always the hope that you're going to survive. I'm sorry, it is cancer, and it's a deadly,
Correct.
very deadly form of cancer. But I've got it, let's say, or I know somebody's got it. How am I going to handle this? How
Well-
am I going to handle this journey, whether it's short or long? Am I going to be sick? I'm certainly going to be frightened. Am I going to fall apart? Am I going to stay together? At what point do I face it? How do I deal with it? How does my family deal with it? How are we going? There's a whole chapter. Talk about that a little bit. That suddenly you are given a potential death sentence. What do you and everyone around you do?
Well, and like I said, everybody's different. Some people want to have their family just embrace it, and they're going to fight, and they're going to do
Right.
everything that they can, and they're going to call us at the Pancreatic Cancer Action Network and make sure that they have a patient central associate at their care
A plan,
table.
and I'm not going to go gently into the
Exactly.
night here, as Dylan Thomas famously said. I'm going to rage against the dying light here.
Exactly. And
Right.
some people are like that, and other people just kind of give up because they feel like they've been handed a death sentence. But the
Right.
reality is, I talk to those people all the time, and they'll say, "Am I going to live?" And I say, I don't know. I'm not God.
Right.
And if you think about it, yes,
As if I know I'm going to live past today. I could
Right.
get hit by a
We-
bus tomorrow. Yeah.
exactly, right?
Right.
And the reality is that we've got 10% of the people that are diagnosed that live 5 years and longer and beyond. That 10% represents thousands and thousands of people. So
Right.
why not you?
Yeah.
Why not your loved one?
That's a good point.
You don't know.
It's only the odds are against it, but why not you?
Why not?
Yeah, could be you. And then even if, whether it's you or not, you can't just close your eyes. You're in this journey now, and it's a journey until it ends. Whether it's 20 years from now or 22 months from now. Here, what's the average lifespan of the people? I mean, it seems to progress rather quickly. Other forms of cancer last longer. If this one can move very quickly.
It can move very quickly, and it's a pretty high number in the 70 some odd percentile of people that are going to lose their battle in the first year. But
Wow.
we want to make sure that we are there by their side, that we are giving them all of the most current, up-to-date information, many times to share with their doctors.
And the best chance for survival, the best stories to provide you hope and inspiration, and some real life stories of what the real life struggle you're in for here, what this is going to look like and how you're going to handle it before. And I suspect as hard as it is in the people going through it, you've got a world around you. How was it to watch your mother go through this? I can't imagine.
It was very difficult. She was the first parent that I lost, and she was really the first time I had an up close and personal experience with a pending death.
Yes, right.
And it
Not
was
not a possible death, a
well back back then
they're presenting
there
it
was
as a pending death, right?
exactly, there was no hope. And like I said, today sometimes, many times, is a very different story. But watching my mother go through this, and watching her lose so much weight, and watching her lose her appetite, and watching her lose her ability to get up and move like she normally did, and towards the end, her inability to even communicate with us,
Yeah.
it tore me apart.
And it can tear families apart, it can tear marriages apart. It can
It absolutely can.
and leave people angry or hurt or in denial. I mean, I can't imagine the collateral damage to the extended family and friends that this happened. I get it. It's about me. I'm dying. But what is this going to do to my family and my friends and everybody else around me?
Well,
So,
and that's one of the things I think many times we tend to overlook the caregiver or caregivers, and support for them is so very important because
absolutely.
they too are in the battle of their life.
I will only tell you, and I'm sure I'll share this more as we go on. I did not have anybody that died of pancreatic cancer, but I've lost both of my parents. My mother had Alzheimer's. My dad fell and had a brain concussion. The brain. My dad used to say for years, "I wonder what's going to take me someday." I said, "Dad, I don't want to talk about this." And at 93, he was pulling a loaf of bread out and fell and banged his head, and that's what killed him. He fell, and his head
Oh my
swelled up.
gosh.
You know, the most unlikely. He went through. He had what's the cancer of the blood? Leukemia.
Leukemia.
He had a stroke. He had heart bypass. He flew through that like nothing, but fell and hit his head, and it was all over within weeks. So you never know. But I guess the point I'm making is I went through that. I'm an only child, and I was the only one there for both of them as they went through this. And then my late aunt, my mother's unmarried sister. So 3 times I went through losing these people, all for different reasons. And each time I thought I was totally alone. There was nobody to help me. I went to the doctor and they went, "Time's up. Hey, I don't know what to tell you. I've done everything I can do. I don't know where to send you. I don't know what to tell you, but time's up. Next patient, please." And I just felt totally alone in each and every case, and angry and hurt and frightened and confused and everything. And I'm supposed to be helping them. They're frightened and confused, and I'm supposed to be giving them some ideas and advice. And so often there's so little. I guess there is stuff out there, but people don't know of it, and the doctors don't seem to steer. Do you find that? Do doctors just sort of wash their hand to something? It's almost an embarrassment. I can't help you anymore. I've done everything I can.
And it really depends on the doctors, but it's that same exact feeling that you just described that really propelled me to do something
I'll bet.
about it, because I felt those same feelings, those same emotions, that same sense of being so powerless
Yeah.
against a disease
So
like
unprepared.
this.
So, and I'm an analytical person. All right, give me the data. Let's do the research. Let's
Right.
find this. Tell me the facts and how we can fight it. And you're on your own. Good luck for most of the people. Now, thank goodness that organizations like yours are springing up to provide support, education, information, and I hope people will come back and listen to these stories. These are stories we should, because it doesn't just pancreatic cancer. This is a deadly story that has even more ramifications and fear and whatnot. But this is the story of all of us. We're all going to go through this at some point in time, or know somebody that goes through this.
Right.
And I don't think any of us are ready for it. That's just I may be getting on a soapbox here, but I just don't think
Yeah.
we're ready to face any of these things. We
And-
live in denial of it.
And how do you prepare yourself? I mean, really, truly,
Really,
you
yeah, that's
can't
true, yeah.
really prepare yourself for things like this, but you just always have to remember is to seek out as much information as you can
Yes.
to make informed decisions. And I think we've got the benefit now of the internet. We've got the benefit of social media, that connectivity.
Isn't that the truth? There is some place to go, right? Yeah.
And one of the things that was so important as we were building the Pancreatic Cancer Action Network is to create a community for people, even whether it's during a journey with themselves, a loved one, or even afterwards.
Afterwards, you hit it on the nail, because when it was over, everybody was like, "Okay, 2 weeks went by. Your dad died. I feel really bad. Let's get back to work. Let's go."
And
It's like, I'm not ready. I'm still feeling it. I'm still, everybody else, the world's moved on, and I'm still grieving here. Yeah.
And you know what? And this is just kind of like my own personal way of looking at things, but I always feel like with a disease like pancreatic cancer that's typically so swift and everything happens so quickly, I think in many cases, and again, these are my numbers, I'm making them up, but I feel like at least 80% of the folks that go through a journey like that just need to get on with their lives afterwards. And it took me a long time to wrap my head around that. But the people that come to, whether it's our organization or another pancreatic cancer organization, the people that come to us looking for a place to feel empowered again, because we are all cut from the same cloth. We're the ones that
You've been
couldn't
there, yeah.
just walk away. And there's tremendous power in that.
There is. Well, how do people reach you if they are been diagnosed? They know somebody is diagnosed. They're going through any of this. There is a place and a space and a community that can help you when the doctors say, don't know what to tell you, go home, put your affairs in order. You got pancreatic cancer. Next, it's the Pancreatic Cancer Action Network. I like that. It's not a passive group here.
That's right.
Action, and it's a network. It's not just two people giving you an idea here. How do they reach you, and how do they connect with you?
Okay, if anybody is traveling this journey currently or knows of anybody that is traveling the journey or in the future hears of anybody, our toll-free number is 877-272-6226. Our website is www.pancan, P-A-N, like in Nancy, CAN.org. Connect with us and we will make sure that we will provide you with the most up-to-date information to help you or your loved one travel this journey.
And is it a journey that we go through and then go on and we forget about the Pancreatic Cancer Action Network, and now there's a new group on the journey and a new group of passengers arrive and head in the thing, or do people stay with you and stick with you and support you and volunteer and help? I suspect it's all of the above. But
well, it's different for everybody, but I would like to think that more people than not join our Purple family, because we joke all the time, but it really is real. When they come into our family, they're feeling that big purple hug.
Yeah, right.
And we want
You're
them
all wearing
to know
purple today here.
Yeah, we are a family for them, and we are going to provide them with the vehicle to be able to, get through their grief, but like I said, feel empowered to do something for the next person.
And to help someone, because then that's the only thing it's the only way you can make some sense sometimes of going through this.
Absolutely.
If I go through all this and then just forget it and don't tell anybody about it, I haven't honored the person that died. I haven't helped anybody else down the road. If we all pass it like a bucket brigade, there's a fire raging, somebody's got to grab the first bucket and then hand it to the second person. They hand it and we create a line that we can put out these fires. Well, I think it's a beautiful idea. I think it's a powerful idea. I think it's an overdue idea, because having gone through my own journey with three aging parents, or two aging parents and an aunt, it was a lonely journey. It was a difficult journey.
Yeah.
And when it was over, everybody wanted me to just turn the page and forget about it. And it was hard to do that. So I think for all of those reasons, these sorts of stories, and to support your last point here, it is different for everybody. Some people are going to rage. Some people are going to roll over. Some people are going to stay in the fight forever. Some people, it's too painful to think about it and they can't deal with it past tomorrow. There is no right way. When you're going through these emotions and feelings, somebody can't. That used to drive me crazy. People would come and say, well, you can't feel that way. You can't do that. You shouldn't do this or whatever. It's like, who are you to tell me? It's my journey, right?
Yeah, like the people that tell people, oh, you should be feeling this way during your grief. No, it's different for everybody.
Yeah,
and
time's up for the grief. Now it's time to move to this.
And any way that anybody decides to deal with it, that is their choice, and it's okay. We just want people to know that there's a whole family of us out here that are ready to embrace you, that are ready to provide you with opportunities to do something to make a difference, to change history.
Yeah. I know we've gone a few minutes over here, but I'll give you one more little one that struck me, is how, I'm just turning this into my own little personal tirade here, but I was always amazed how your friends and family fade away at this moment. I don't know, and I guess I probably have done it too. You don't know what to say. You don't know what to do. You're uncomfortable with it. You don't want to think about it either. I'm really sorry you're going through this, but I really don't know what to do to help you, and I really can't sit and discuss this. And so you're left alone too often to ride this journey alone. You've now providing a family and a network of people who've been there and done that. That's got to be power. Well, thank you so much again. One more time, how do they reach you?
The phone number is 877-272-6226, and the website is www.pancan.org.
All right, we'll come back each and every week. We're going to give you some living hope, real life stories of people really dealing with this deadly disease, and where you go for hope, for ideas, for information. Hopefully it's here. Thank you so much. We look forward to having you come back and give us updates from time to time as we bring in others who share their journey of living with pancreatic cancer. You've been listening to Living Hope, a weekly show designed to provide you with some real-life examples and real-life stories of those affected by this and how they deal with it on a daily basis. If you'd like to share your stories, we welcome you to come on. And if you need help, just contact a patient services. That's 877-2, the number 2, PANCAN, PANCAN. They're there to help you. And we hope that you'll help us by spreading the word and telling these stories. It's only through stories that we learn and get some living hope.